in infection prevention or in dealing with communicable disease. And so we're asking really extraordinary things very quickly of people for them to understand and grasp big concepts and become trained and experts on infection prevention. And we can't really expect people to just get it. And we really need to make sure that we continue to foster ongoing education, opportunity to ask questions. We know with education that it takes oftentimes up to 20 times for someone to really take behavior change or make an action on a behavior change message. So as many opportunities as possible for us to kind of get education out there is the best thing. So that's why we're coming into facilities, and that's why we're talking to you today. Some of this information may be new, and some of it may be just a reinforcement of something you've heard before. But I do encourage you as we go through to just kind of think of ways that you can help to role model or help to spread messages around these concepts that we're talking about today. As kind of we move in the community and things are, things kind of lighten up and people get kind of cooped up and they want to go out and do things, it becomes more and more important that we're really watching our hand hygiene and our masking. So we'll talk about that today, because now's the time to get a little more rigorous and not less, right? So we're going to move forward and talk about what we're covering today in today's training. So today we're talking about just general COVID, like what is COVID? We'll just give a little refresher. We're also going to talk about infection prevention and the things that we know work and just reinforcement of those. Also talking about best ways to protect yourself outside of work. We know that when we come to work is not the only time we need to protect ourselves. So it's important that we understand how to protect ourselves and our families outside of work. And then we're just going to talk about updates, what's happening in the community. You're going to hear from our public health representative for Sonoma, who's going to give us some kind of tips and kind of observations from contact tracing. So let's get started. So let's just talk a little bit about COVID-19. So most of us at this point know that COVID-19 is a coronavirus, right? Now, COVID-19 is a novel virus, which means it's new, right? But coronaviruses themselves aren't new. So we've actually been dealing with coronaviruses for quite a while. There are lots of different types of human coronaviruses, and most of them cause upper respiratory infections. Since COVID-19, we're still learning about it, but we are able to kind of tell how it may behave based on what we know about other coronaviruses, right? So coronaviruses spread mostly person to person, mainly through contact with respiratory droplets. So when someone's talking, sneezing, coughing, even just breathing, right? They don't have to be actively coughing, but even just the act of breathing. When you're breathing or talking, you're kind of expelling respiratory droplets. And you'll see in the picture, if you can see the slides, that most of the times with a respiratory virus, right, with a droplet virus, your droplets are going to fall to the ground or whatever's in front of you within 6 feet. That's where the 6 feet of social distancing comes in. Sometimes, however, there are certain situations where those droplets can be pushed hard and fast enough that they do what we call aerosolizing. So there's certain procedures in a medical facility like intubating, extubating, using high flow oxygen, inserting like a trach or working with someone with a trach, other things like that, that can cause the droplets to push hard and fast enough that they can float on the air a little bit longer than they typically would. And that's what we call aerosolization. So if you think about like a space shuttle, right, theoretically that thing should not go into orbit because it's so big. But if you push anything hard and fast enough, it's going to behave a little bit differently and may be pushed into the air a little bit longer and more widely spread than it normally would. So what we do know is it's mainly droplet, right? There are situations where it can be pushed into the air and it can be aerosolized, right? So we do know that it's mostly 6 feet, but there are some situations where it can go farther. So that's why we suggest that the distancing is adhered to, and we'll talk a little bit more about that, but also masking anytime you're outside your home is the recommendation. Oftentimes I see people, wearing their mask around their ear, and then if they see someone coming at them when they get close, they'll put their mask on. But we really need to have it whenever we're in public for the most part, because if someone's working out or expelling, riding their bike or coughing heavily or yelling or laughing loudly, you don't know if maybe those droplets could travel a little bit farther. So we can answer questions on that at the end too. We get a lot of questions about that. So moving forward, when someone becomes infected with COVID-19, their symptoms may be mild or they may not have symptoms at all. So what we know about this virus is that there are a lot of people, almost about 45% of people actually, who are positive walking around in the community who may not have symptoms. So they don't feel sick, so they're not staying home. So they may be walking around positive. So that's why we really encourage people to treat everyone like they're positive. And I know that's not a good feeling right now, but until we have the spread really paused and until we flatten the curve, it's really a good idea to kind of think of it as everyone's positive until they're not positive, right? So I actually encourage people to make sure that even when I come into a facility, when I'm visiting a facility, treat me like I'm positive. What would you do? Make sure I'm wearing my mask, make sure I'm washing my hands. Even though I get tested regularly and I know how to avoid COVID-19, it doesn't mean that I'm safe, right? So unfortunately, what we see is that in the community, because there are so many people who are walking around without symptoms and they may not feel sick, and because most people are getting sick of wearing a mask. I mean, most of us, right? I know me, sometimes at the end of the day, I'm like, man, I wish I just didn't have to wear a mask tomorrow, right? But we're seeing people remove their masks more with their small social circles. So there's been this concept of like a social bubble or a small social circle before. And really one thing we want to really talk about is your social circle. While you may know them well, you don't know who they're also kind of hanging out with, right, without their mask. So the concept of a social circle is really, we have to be careful when we think of it that way, because what we're seeing mostly in the community is that people are contracting COVID not at work when they're on their best behavior, but it's when they're carpooling with friends or when they're on the weekends and they're hanging out with a small group of friends or even a large group of friends with their masks off, right? So we do say when you're with people who do not live in your household, distancing and masking are still essential, even if it's someone that you know well. Because the idea of a social bubble is we're all connected, and COVID doesn't really respect boundaries. It doesn't respect county lines. It doesn't respect social bubbles. We just have to be really, really careful right now as the community spread is so large. So moving forward, let's talk a little bit about masks. So right now there's 3 types of masks that we're seeing in the community, right? So most of us have probably seen the cloth face coverings. The important thing to remember about a cloth face covering is that your mask protects me and my mask protects you. So I'm going to say that again. With a cloth face covering, my mask protects you, your mask protects me, right? So the cloth face covering, the cloth fits closely to your face and therefore prevents any droplets that you're expelling when you're talking or coughing or sneezing from leaving that mask, right? But it doesn't necessarily protect you from inhaling that because it's a cloth face covering, right? So really the cloth face coverings only work when both people in the conversation or the interaction are wearing them. Oftentimes we see one person wearing and not the other. And really we'll show a graphic in a little bit about that. And really you're doing your job, you're protecting the other person, but they're not protecting you. So both people need to be wearing it. That's why we encourage cloth face coverings out in the community, right? When you wear a cloth face covering, you still need to distance. Well, when you wear really any mask, you still need to distance, but especially the cloth mask. And this is really important right now as we open up and places become more crowded, right? social distancing is still a thing. Wearing a cloth mask does not negate the need for social distancing, especially in areas where there are a lot of people or where you may encounter people frequently, like at a grocery store or something like that, right? Sometimes a cloth mask can provide like a sense of security for people, like I have a cloth mask on, but you still have to remember that you don't know if that person may be walking around with COVID and may not have symptoms, right? Unknowingly, it's not their fault. And if they're not wearing their cloth mask appropriately or not wearing the right one, they're not necessarily protecting you. So you need to still adhere to the distancing and wearing your mask, right, to protect the community. If we have the statistics are, if we have 80% of people in the community wear their cloth face covering, we'll see such a flow and spread that will easily become off the watch list. So if we can just get 80% of people to wear their masks, we'll be good, right? Okay, so moving forward. Oh, sorry, actually. So the second type of mask is the isolation mask or the surgical mask. Sometimes you'll see it called surgical, sometimes you'll see it called isolation. It's really the blue or the white one that you often see. And this is one that you'll be wearing in a facility. So the important thing to remember is that cloth face covering, that is for the community, right? That's not for resident care or patient care areas. When it comes to patient care or resident care, you need to either be wearing the isolation or surgical mask or the N95, and that depends on what your facility is recommending for whichever area you work in. So whether you're a caregiver or whether you're housekeeping or dining staff, it doesn't matter. It's still important that you're wearing one of those two masks if you're going to be in resident care areas. Anybody working or coming into contact with residents needs to be wearing those. Cloth masks are only meant for the community, or if you're an administrator in a facility and you're working alone in your office and you find it more comfortable. As soon as you step out, it needs to be an isolation or surgical or an N95, depending on your area. The N95s, which is the last one, the farthest one on the right. So the N95s are for care of patients that are COVID positive or under suspicion of being COVID positive because they're either symptomatic or they were exposed to another COVID positive person, right? And you may see this expand as we develop because as we know about COVID, things are always changing, right? So the masking guidance may expand, but for right now, the N95s really need to be worn 100% of the time by anybody entering a room and providing care for those individuals who are COVID positive or who are suspected, exposed, or symptomatic. And that goes along with the rest of your personal protective equipment that we're not going to go over today. But if you're not trained on PPE and you're being asked to wear it, you really need to get the training for that, because the putting on and taking off of PPE is essential to make sure that you don't contaminate yourself and expose yourself to COVID-19, right? The one thing to note here about N95, we're not seeing them a lot anymore, but there are still some out there. There are N95s that have valves on the front of them. Those N95s with valves should not be worn in a facility. In fact, in the public health orders for both Marin and Sonoma counties, the valved masks are prohibited inside facilities. So we never want to wear an N95 that has a valve in it. And the reason is those valves are meant for exhalation, like easy breathing out, right? So think about it, if this valve is for easy breathing out, then it could allow droplets to escape. So you could potentially be exposing others if you are positive, right? So again, that mask is not protecting others. So I do recommend if you see those masks with the valves in your facility, that you say something, because that needs to be remedied soon. All right, so moving on to the next. All right, so if you want your mask to work, you have to wear your mask, right? So we have seen all these things, right? The mask below the nose, the mask above, resting on the chin right underneath the lip, or we call one the chin strap, where people have it lowered. Oftentimes when somebody's getting on the phone, you'll see them lower their mask and have it become a chin strap. We've seen them hanging off ears, or I've even seen headband masks, right? Unfortunately, a lot of these methods of wearing can really actually contaminate you and aren't protective for other people. The big thing to remember is oftentimes with the surgical mask or the isolation masks, as you're talking, they have a tendency to fall down your nose, especially if you have a nose that kind of curves or is flatter to the face, if you don't have a big German nose like I do, right? When the mask falls beneath the nose, you're actually breathing out and in through your nose. So you're not doing anything, right? You're not protecting others and you're not protecting yourself. In order for the mask to work, it needs to cover both the mouth and the nose. Anytime the mask falls below the nose, you need to adjust the mask. And if for some reason the mask continues to fall beneath the nose, then perhaps that's not the right mask for you, and you need to think about either a different type of mask that may fit more securely, or making sure that it fits the bridge of your nose, and there are other ways that we can kind of remedy that. Anytime you are adjusting your mask, it's important to remember that anytime you touch your mask, your hands need to be washed before and after. When you're touching your mask, you're touching a potentially dirty surface, right? So depending on where you've been wearing this mask, you could contaminate your hands by touching it. We see a lot of people move their mask up with their hands, and you really need to wash your hands right after that as soon as you touch your mask. Oftentimes what we recommend is when you're adjusting your mask, you use the ear loops. If it's a surgical mask, your N95 should never really need to be adjusted, and we'll talk about that in a minute because it should be fitting to your face. But when it's a surgical mask, you should try to use the ear loops or the bottom of the mask, right? Just kind of sticking your finger like right into the bottom part of it and then washing your hands immediately. When you're storing masks for prolonged use, they should be stored in a paper bag, not a Ziploc container. We've seen some Ziploc containers, and what they actually prevent is air moving over. So what we want and why we like the paper bag is because we want air moving over your mask, A, to dry it out, but also to allow for the interchange of the air and the virus, right, just in case. So we want them to be dried out. We don't want your mask to be damp when you put it back on the next day. If it is, you need a new mask, right? So we never want our PPE to be wet or visibly soiled, dirty, anything like that. When it comes to putting your mask on, taking your mask off, if you ever touch the inside of your mask with dirty hands, you need to get rid of that mask and get a new mask, right? The inside of your mask should always be kept clean, right? And then after, anytime it's visibly soiled on the outside or becomes torn or wet, then again, change masks. Moving on to the N95. The N95, the important thing to remember is you should be fit tested for an N95, and you can work with your administrator on that, right? So working with your administrator and fit testing does not mean that you're just good to go with every N95. So every time you put your N95 on, you should be performing a self-seal check. And the self-seal check, you can do it one of two ways. You can either put your hands around where the air would escape, holding the mask, and blow out, right? And if you're doing the blowing out of the mask, you should feel the mask kind of blow out before any air escapes the seal, right? And then, or you can do the same thing and inhale sharply twice, and you should feel the mask kind of fold in on itself. If at any time you're feeling those things don't happen, or you're feeling a lot of air coming out from the seals, your mask is not fitting you appropriately. And if your facility wants more help on doing those things, they can contact us, and the information will be later in the slides. It's important to do the self-seal check every time you put your N95 on. There should be no exceptions. And then when it comes to the straps of the N95, the bottom one should always be behind and on the neck. If you have long hair, it should be touching skin and not hair. We see often the hanging strap, and that means your N95 is not sealed to your face, and you might as well be wearing a different mask because it's no longer an N95, right? So moving forward.
Karina, did you just want to say one thing about double masking?
Yeah. I was going to do, yes,
okay.
yes. So, again, I'll go ahead and say it here. So again, if you want your mask to work, you need to wear it right. And that comes with wearing the appropriate mask for the appropriate situation. We do not recommend the use of double masking. There are some situations, for example, if you are in a situation where it's been recommended by public health or your administrator because you don't want to soil your N95, that's different, and that's something that you're working with your administrator and public health on. But in general, we do not recommend double masking. More is not better when it comes to masking. You should be wearing the right mask for the right situation. So if you are feeling as if you're not, that's something to have a conversation with your administrator or with public health about, or calling one of us on the numbers. The masks, we know the masks work, right? We've been dealing with viruses like this for a really long time, and the masks that we have recommended are the ones that are right for the right situations. So there's no need to double mask because it's not providing you more protection. In fact, sometimes it can actually make it a little bit harder for you to breathe. It can make it more uncomfortable, especially in the hot months. And it can make it easier for people to more people are going to want to pull their mask down to get some air more, right? I don't know about you, but sometimes if it's like a really hot day out and I'm talking a lot or breathing a lot in my mask, it gets really hot and humid in there, and I just want to take it down. Think about if you're putting multiple layers on and it's not providing you more protection, all it's doing is making you want to take off that mask, right? If you are in a situation where it's recommended that you double mask, which again is not many, always remember, never put anything under your N95. We are seeing at some facilities, some people are double masking, and unfortunately they're putting their isolation or surgical mask under their N95, and that needs to be switched. Anything that you put under the N95 will interrupt the seal, and it no longer makes it an N95, right? Remember, the reason that the N95 works is because it sits tightly to your face. It's intended to have a seal to where you're forcing anything that you're breathing in and exhaling to move through the filter piece, which is the mask, right? So think about if you're putting something underneath that and interrupting that seal, then you're no longer doing that, right? So just like we don't want you to have facial hair or other things underneath that mask, we don't want you to have an isolation mask under there because you're not being protective for yourself or others like you think you are. So thank you, Maria. All right, be sure, there we go, moving forward. All right, so moving on, this is a graphic really about just remembering the risk here, right? We know how COVID is spread. We know 100% that masking is hands down the best protection against COVID-19, against contracting COVID-19. We know, of course, that hand hygiene is important and that there are situations where you can touch a contaminated surface and then either touch your eyes, nose, or mouth, and you could contaminate yourself that way. So we do still recommend the hand hygiene. We'll talk about that in a moment. But hands down, if you do one thing today to make sure that you're doing the best thing for your family and yourself, it's to make sure that you are not taking that mask off unless you 100% know, like you're in your car or your office or the bathroom completely by yourself. Oftentimes we get asked, what is the best thing that I can do to protect my family if I work in a facility? And my answer always is, there's a lot of things you can do, right? You can take your shoes off and you can wash your clothes and take a shower first thing when you get home. But the number one thing that you can do to protect your family from COVID-19 if you work in a facility is to keep your mask on when you're supposed to have it on, right? Anytime you're around others, anytime you're carpooling, on breaks with others, in the facility, out at the grocery store, right? So when I go home, for me, I know whether or not I've kept my mask on or not. And I know that if I did, I've done the best thing that I can do to protect those that I care about at home, because we know that the masking is the main kind of control for COVID-19, right? So remember, when you have two people masked appropriately, socially distance, the risk of contracting COVID-19 is very, very low. It is a contagious virus. We're not going to sugarcoat it for you. It's an extremely contagious virus, right? But we know what works. And so that's why we're really accentuating the masking at this time. As things reopen, it's important to remember that. You know, earlier I mentioned it, and it's worth mentioning it again. As things reopen, people are going to be moving more and more about, right? And so I think I'm even seeing it now where people are kind of huddling in closer groups and removing their masks. So we just need to kind of serve as a role model, because it's our actions that affect our families and the people that we work with in facilities. So moving forward, another thing about hand hygiene is extremely important for any type of reducing any type of transmission of any illness, including COVID-19. But remember, there's other things out there as well, right? We're entering flu season. So now's the time to get strict about hand hygiene again. I know when COVID-19 first started, my hands were bleeding because I was washing my hands all the time because I was so nervous. I was always like, oh no, I'm gonna get it. And I've gotten a little more relaxed in my hand hygiene, and it's a thing I need to remember, that hand hygiene, right? Again, anytime you touch your mask, anytime you're entering a facility, exiting in a facility, when you first get home, and basically if you think you should be performing hand hygiene, you should. So one of the things that we like to touch on just briefly is that there's oftentimes this, like you just run your hands under the water, right? And just kind of put the soap there, and that's often hand hygiene for most people. Same with hand sanitizer. But there are frequent areas that get missed. We put people's hands under black lights, and what we see are fingertips, thumbs, in between the webs of the fingers, backs of the hands, and wrists often. So when we're talking about hand hygiene, remember it needs to be 20 seconds, at least 20 seconds, 20 to 30 seconds preferably. You're going to wet your hands, apply enough soap to cover all the surfaces. You're going to lather, rubbing together briskly, and you're going to get between the fingers, backs of the hands, right, in the webs. You're going to come down, get the thumbs, get the wrists, and then you can get the fingertips and the nails by either rubbing your palm or by cupping your hands together and getting the fingertips and nails that way at the same time, either way. And then you're going to rinse and dry. When you're using hand sanitizer, it should be the same action, backs of hands in between the webs, right? And in that instance, you're going to rub until your hands are dry. Oftentimes I see people having to kind of shake their hands out for the hand sanitizer. Really, you should be rubbing it until it's dry. And if it feels like there's a coating or it doesn't dry fast, like you have to wait for 5 minutes, that's way too much hand sanitizer, right? Okay, so moving on, I'm actually going to turn it over to our public health representative, Stacy. I think you guys have gotten enough of my voice. So Stacy's going to give us some updates on what's going on in the community and talk a little bit about trends and ways that people are exposed right now.
Thank you, Karina. That was an awesome job. I'm Stacy Evans. I'm a public health nurse with Sonoma County. And I'm just going to give a little update. Basically, we are still seeing some transmission in Sonoma County. And so we want to focus on what we're doing and kind of just discuss the levels of risk. This slide here kind of shows levels of risk in terms of activities that we can do. And we kind of know, staying home and being with our family is on the safe end, and then going out and being in more public activities and groups is on the less safe end. What we're seeing is of transmission in the long-term care setting. We are seeing preventable transmission in terms of healthcare workers. And I think most of this goes towards our social interactions. We all want to communicate with our friends and our colleagues. We have good relationships. We like to get updates on how the family's doing, what kind of vacations you're going on, all kinds of communication that's important to us. And we want those communications to still happen. But it looks like it's in those moments when it's most difficult to maintain your practice of wearing your mask and keeping your 6 feet of distance. So I just want to bring that up because we are seeing transmission there. And I want to encourage everyone to feel comfortable speaking up when they see someone not wearing their mask right or getting too close. And just, if you feel like, oh, I don't want to be that person who's judgmental or just feel uncomfortable doing that, just sort of take a moment to yourself and take a deep breath and just remember, you're doing this out of kindness because this is a way to protect yourself, your family, and your whole community. I'll tell a little story about something I learned from one of the contact tracers where she didn't feel well and she had a family member that was also going for a COVID test and they had reason to believe that the test was going to be positive. And so she just, self-selected herself and did a quarantine. And by doing something like that, she probably prevented a workplace transmission. So I'm just trying to advocate for people in the direct care role to really take on these practices and speak up and do the right thing. Recently, we have opened up some guidance for communal dining, and we can see if there's any questions on that when we do the Q&A part. But basically, we're limiting dining to less than 10 persons at a time. We're asking you to stay 6 feet apart and wear your masks until you start eating, do hand hygiene, all the basic stuff. And we're also asking facilities to keep a log of who's in the dining room in case we do need to do contact tracing. I think that's about it that I have for now. We'll just go to, I think Maria's going to do the slides on the resources that we have.
Yeah, and can I add a couple things too to your point, Stacy, if that's okay?
Sure.
Thank you very much for that. That's exactly right. We're noticing here as well that it's the majority of the time it's people are very good at work about keeping their masks on. It's when they leave work or on their breaks, sharing a meal with someone, going for a walk in the community, or carpooling that we're seeing a lot of transmission. And when I say we're seeing, just like Stacy said, it's through the contact tracing. Another thing we're seeing is, and I don't know if this is true with everyone, but as right now, when things are smoky and hot, oftentimes we're inside and things are getting really congested in there. Windows are closed, air is recirculating, and people who have really hot jobs because they're moving a lot, or they may be in full PPE, or they may be working in the kitchen, they do need more frequent breaks or thinking about ways to make sure that if they are taking a break to get a drink and hydrate themselves, because we know when we wear these masks, oftentimes we can become more dehydrated, A, because we're not drinking regularly, but B, because it just takes a lot of work to breathe through the mask, right? So if you are someone who is working in a hot situation and you oftentimes keep a drink with you, one of the things that we really want to caution you against is just taking your mask down to take a drink. We want to encourage you to find an area, a break area where you can remove yourself from others, because unfortunately we have seen in areas where it's almost impossible to socially distance because it's congested, like a kitchen, we see people keeping drinks on the line and then they'll take their mask down and then the mask may stay down or they may have a conversation. So we want to encourage you to find little pockets and ways to kind of rethink maybe how you might have done things before, if that makes sense. That's my one point.
I just have one more thing I wanted to throw in. One other place where we're seeing transmission is when we have people working at multiple facilities. So, we recognize that in order to live in Sonoma County, you might really feel like you need to have the 2 jobs, but I'm going to encourage, I know we have staff and administrators probably on this call, so this message is, for both of you really. offer people a 12-hour shift instead of an 8 and see if you can make some kind of a deal where someone can agree to just work exclusively at your facility, because that will really cut down on the transmission in the county.
So thank you both, Karina and Stacy, so much. You provided such great information. I wanted to add one thing to the updates, and that is that we spoke and we anticipate that as our counties, I know Marin County just yesterday moved from purple to red in their stages of reopening. So congratulations, those of you that are in Marin County, and hopefully Sonoma County will follow suit. But we believe that as things start to improve, and Karina mentioned that it's during this time that we be even more diligent about our behaviors that we know protect ourselves, the residents in our facilities, and our families from COVID-19. So as restrictions start to loosen, those practices become even more important. And I also encourage those of you, that are administrators and even staff at your facilities, think about although this has not happened yet, and I want to be clear about that, but we anticipate that down the road, we're going to see some visitation begin to be allowed again. And it's likely that it's going to be outdoors. The requirement will be that it's held outdoors, that, we would recommend that anybody that resume visitation at your facility, that you spend some time educating them and making sure they understand the required precautions in order to keep their loved one and their family safe. Maybe think about down the road setting up a space such as a table that will help you maintain a 6-foot distance in between or more in between the visitor and the family member or the resident. And then also think about having a staff person or an administrator present. Again, this has not happened yet, but we want you to be thinking down the road and how you're going to maintain the safety of your staff and your residents once we start to move to the red stage of our reopening and potentially these restrictions start to be lessened or lifted. The next thing we wanted to just mention is, and I wanted to let you know that I'm going to send these slides out. So I'll give them to Carly. Carly can forward them out to all of you. We're also recording this. If your staff wasn't able to join you today, we felt like we really wanted to talk to staff as much as possible. So when we send out the recording, we really encourage you to share it with your staff. As health educators, we know that people have to hear things 7 or 8 times before they commit it to memory and to practice. And so if you feel like you've been harassing your staff, continue to do so. That is what's going to keep your residents, your families, your loved ones safe. But you don't need to copy these numbers down because you will be receiving these slides probably tomorrow. We just wanted to remind you that if you do have a resident that starts to display symptoms, mild symptoms, such as a fever or a cough, the first thing you want to be sure to do is isolate that resident. So hopefully all of you have come up with a plan for how to safely isolate a symptomatic resident. But that's the first step you want to take, and then maybe make sure that you're donning and doffing the appropriate PPE when checking on that resident that has become symptomatic. At this point, you're assuming that that person has COVID-19 until proven otherwise, until you have a test that indicates otherwise. So don and doff appropriate PPE and maybe increase monitoring. Hopefully you have a designated individual in your facility that is responsible for implementing your plan should you have a resident that develops symptoms. So you'll want to be sure that that individual is notified, and they're the person responsible for contacting the public health department, alerting the public health department, and contacting the resident's primary care provider. Those are the 2 phone calls that you should make immediately after quarantining the resident. So if the public health department is not going to come out and conduct testing, maybe it's a Kaiser resident, the next thing you'll do is contact the primary care provider. If they are a Kaiser member, we also have a 24-hour hotline that's listed on this slide. You could use this number as an alternative to contacting the primary care provider. But either the public health department or the resident's primary care provider will be responsible for arranging testing at your facility and providing you with next steps. I also just wanted to mention that if the symptoms in this resident are, of course, severe or life-threatening, or you feel like that they need care that exceeds what your facility is able to provide, at that point, you really want to consider contacting transport personnel, making sure they know that you have a potentially positive resident. And put, the hospital or facility that you might be considering transferring the patient to. But I also wanted to remind you that it's critical that particularly for patients who are near end of life, potentially are on hospice, what those patients' wishes are. We are really encouraging as, a representative from Kaiser that you have those physician orders for life-sustaining treatments either on file or displayed for every resident in your facility, because it can become pretty catastrophic when somebody is COVID positive and then their wishes are not to receive life-sustaining treatment, and they're then transferred to the emergency room, and et cetera. So we just want to make sure that we remind you of that, the importance that the POST plays, especially during times like these, and reminding you to keep an eye on that, and as much as possible, respect the wishes of your resident. Again, these are going to go out with the slides. This includes our contact information as well as the contact information for the counties that your facilities are within, as well as some additional resources should you find yourself in need of additional training or resources for you and your facilities. Again, these are our contact numbers. I'm Maria with Kaiser in Santa Rosa. Karina is with Kaiser in Marin. We have a lot of resources related to education and training. We would be happy to visit your facility or conduct a virtual training if you determine that's something that you need. But again, we encourage you to capture the recording when we send it out and share it with your staff if they're not with you today. The last thing I want to say is that Carly is going to open she's going to take all of you off of mute, I guess I should say, and open the meeting up for questions. You might have to unmute yourself if you called in as well as are using your computer monitor. So just be aware that you probably know by now, but technology is not always our friend. And so if you're trying to speak and we can't hear you or we're not responding, you might still be muted. So Carly, I would invite you to do that now. And Karina and Stacy, is there anything else you'd like to add before we invite questions?
There was Karina. Go ahead.
This is Carl. There was just a comment about in the chat while we were talking about wearing a mask inside out. I don't know if you wanted to address that, and while we address that, I will start to unmute people.
Perfect. Yes, you actually read my mind. While Maria was talking, I got a mask. So specifically, this is I hope everyone can see it, but if not, I'm holding up a blue or a surgical mask or isolation mask, whatever you want to call it, right? So again, to remember before you're handling your mask, hand hygiene, remembering from the slides before that it's at least 20 seconds, rubbing in until dry, getting webs of fingers, fingertips, thumbs, et cetera, et cetera. It's important to do that even with hand sanitizer. Just because it's sanitizer doesn't mean it miraculously covers your hands. And then we have our surgical mask, right? We want to handle the mask by the loops right here. You can see that the inside of the mask is white, right? And it looks a little rougher. You'll also see kind of that the insertion points on the outside, but the inside of the mask is white. The pleats are going to go up. At the top of this mask, there'll be a little either metal or plastic bar. So that's how you know where the top is. So again, with clean hands, I'm going to find that bar, handling it by the loop. I'm going to bring the mask. Hopefully this doesn't muffle my voice. I'm going to bring the mask to my face, ear loops on. I'm going to pull the bottom of the mask under my chin. The top of the mask is going to go at least to the middle of my bridge. It's sitting on kind of like the top half of the bridge of your nose is always better. And then you're going to take both hands and apply the first two fingertips of both hands, apply even pressure to the nose piece of the mask to really fit it to the bridge. Sometimes what we see is that people don't have a really strong bridge to their nose. There's not a big kind of easy way to get it to fit. So you might want to bend a little bit before you put the mask on, but try to avoid a really strong point on these masks because it will affect the way that the mask fits, right? So you never want to like point or pinch or anything like that. Try to apply even pressure. And the blue side or the white or pink side, depending on the mask, but it's typically blue or light green, should be out, right? The outside of the mask should be shiny-ish, right? The inside is going to be rougher. I know shiny-ish isn't really a word, but the inside, if you hold it up to the light, you should see there's actually a special coating on the outside of this mask. So you always want to have it worn the right way because wearing it inside out is not the appropriate way to wear it, and it won't be as protective and it'll be more uncomfortable. So I hope that was what we were looking for.
So we would invite you to ask questions now if you have them by unmuting yourself, or you can write them in the chat also, and we'll ask them for you. We have about 10 minutes left.
Yeah, we only have 3 call-in users. The 2 of them are unmuted. Somebody with a 510459, when I unmute, you do have quite a bit of background. Everybody else should be able to unmute themselves on their end.
Wonderful. Thanks, Carly.
Yeah, and if you have any issues, feel free to raise your hand or put it in the chat box.
Don't be shy.
Maybe we just answered everybody's questions already.
Well, that would be a good sign, right? That nobody's asking any. You have our contact information, so if any questions do come up following this, this meeting or this presentation, please feel free to reach out.
Well, we appreciate all the participation and everybody joining us this afternoon. It's great to be on this journey together, and you know, we're doing this together, and a big part of that is communication, sharing ideas, and just reinforcing these concepts. Any last thoughts from anybody?
If there are no questions, I just would love to make a comment on working with individuals who are COVID positive or who have recently come off of isolation, if that's okay.
Yeah. Mm-hmm.
So as we see more prevalence in the community and we see more and more people kind of becoming exposed, you will probably see positives in your facility. We hope not, but it's a probability. So the thing to remember is that you should never think it's not going to happen, but always prepare for the eventuality that it may happen. And so one of the things that we are seeing with some staff and facilities is that they're becoming very anxious or scared about working with COVID positive patients or with people who have come off isolation. And I do want to just touch on, if someone's positive, or if someone's coming off isolation, that's actually, to me, that's some of the best people to work with or work around, because you actually know their status, right? We talked earlier where we know that there's quite a bit of people who don't have symptoms walking around possibly with COVID in the community. So you don't know what Joe at the store, whether they're positive or negative. So you know, moving around in the community, you're actually at more of a risk than you are working in a safe, closed environment, wearing the appropriate personal protective equipment, the appropriate mask, right? So to me, working with a COVID positive person, I know they're positive. I know that I'm wearing the appropriate PPE, that I'm careful, that I'm washing my hands and wearing my mask, and I know those things are working. So, and really, we just kind of need to think about it that way, that you're actually at a greater risk out in the community than working in a facility where everyone's doing the right thing, right, following the proper protocol. Working with a staff member, unfortunately, we've seen some people can say that they've been, you know, kind of stigmatized, or people have avoided them or not wanted to talk to them if they come back from isolation. And I do just want to say, remember that we have that isolation in place for a reason, and that when that person comes back, they're fine, right? They've gone through their isolation period, so they're not going to be serving as kind of a continual like risk. We've seen people kind of treat others like they're dirty, and unfortunately, that doesn't feel good for that person. But also, you know, it can lead to some kind of dynamic issues or anxiety amongst staff. So rest assured that the isolation period, your administration works with public health to make sure people are out for the time that they're supposed to be out. And if they're approved to come back, either during their isolation period working with positives or after their isolation period, that's been thought out very thoroughly, and you're at no greater of a risk from that person than you are out at Safeway. So I just did want to touch on that, because we're seeing that more and more in facilities. And just remember that that we kind of, if we're doing the right thing, wearing our mask, wearing hand hygiene, there should be distancing, there should be no more fear from working with someone who's come back from isolation than going to the grocery store and picking up bread on the way home, right? So I just wanted to touch on that.
Thank you, Karina. You know, just gives me a little bit of an idea for another meeting, and I'm just wondering if, you know, if caregivers are feeling fear or apprehension, we could have some caregivers come on this meeting and just talk about their experience and share, you know, what they went through and how their learning curve was. I'd be up for doing that if people like that idea.
I like that idea, Stacy, and I think it'd be good also maybe when we send out the recording to send out a survey to see what you guys thought, if there's anything you'd like to see from this group down the road, what you'd like to learn more about, or any questions that you might think of after the meeting. So we'll do that as well.
Perfect.
All right, thank you, everyone. Have a great rest of your day, and keep up the good work out there.
Bye.
Thank you.
Thank you.